Pulmonary edema, also known as pulmonary congestion, is liquid accumulation in the tissue and air spaces of the lungs. It leads to impaired gas exchange and may cause respiratory failure. Symptoms of pulmonary edema. In cases of pulmonary edema, your body will struggle to gain oxygen. This is due to the amount of increasing fluid in the lungs preventing oxygen moving into the bloodstream. Symptoms may continue to worsen until you get treatment. Symptoms depend on the type of pulmonary edema. Long-term pulmonary edema. The symptoms for long-term pulmonary edema include shortness of breath when being physically active, difficulty breathing when lying down, wheezing, waking up at night with a breathless feeling that goes away when you sit up, rapid weight gain, especially in the legs, swelling in the lower part of the body, fatigue. High-altitude pulmonary edema. Pulmonary edema due to altitude sickness, or not getting enough oxygen in the air, will have symptoms that include headaches, irregular, rapid heartbeat, shortness of breath after exertion and during rest, coughing, fever, difficulty walking uphill and on flat surfaces. External factors. Some external factors can also put extra pressure on the heart and lungs and cause pulmonary edema. These outside factors are high-altitude exposure, illicit drug use or drug overdose, lung damage caused by inhalation of toxins, severe trauma, major injury, near drowning. Other medical conditions. Other less common medical conditions that can cause pulmonary edema include heart attack, or other heart diseases, leaking, narrowed, or damaged heart valves, sudden high blood pressure, pneumonia, kidney failure, lung damage caused by severe infection, severe sepsis of the blood, or blood poisoning caused by infection. Diagnosis of pulmonary edema. Your doctor will look for fluid in your lungs, or symptoms caused by its presence. They will perform a basic physical examination and listen to your lungs with a stethoscope, looking for an increased heart rate, rapid breathing, a crackling sound from your lungs, any abnormal heart sounds. Examples of tests used in diagnosing pulmonary edema include complete blood count, echocardiogram, or an ultrasound, to check for abnormal heart activity, chest X-ray to see fluid, blood tests to check oxygen levels, electrocardiogram, ECG, to look for heart rhythm problems or signs of a heart attack. The first treatment for acute pulmonary edema is supplemental oxygen. You usually receive oxygen through a face mask or nasal cannula, a flexible plastic tube with 2 openings that deliver oxygen to each nostril. This should ease some of your symptoms. Diuretics, morphine, blood pressure drugs, inotropes,